Okay, so welcome everyone to the Centre for Applied Education Research webinar. Today we're going to be focusing on the child health in school work theme and specifically looking at asthma in schools. So the format of the webinar is going to be, we're going to have three presentations. So Catherine Hickman, followed by myself, Simon Peeney, and then Lucy Fletcher will be covering different aspects of asthma within school. There's a Q&A box at the bottom, so throughout the webinar, if you have questions, please feel free to put them in the Q&A box, and we'll come to them after the talks individually, or we'll come to them after the full range of talks, depending on what kind of questions come in. And so there should be some time to have some debate and discussion following the presentations. So the recording will be made available to on the Centre for Applied Education Research and via the YouTube channel for the Centre for Applied Education Research. And I believe that Mallory is also going to be emailing around the link to those, so you should be able to catch up or pass it on to colleagues who haven't been able to make it to the webinar itself. So we'll go around and we'll do just some brief introductions for the three of us who'll be presenting, and then we'll go on to Catherine's presentation. So I'm Simon Peeney. I'm a Senior Research Fellow in Leeds Institute of Health Sciences based at the University of Leeds. I've been a qualitative applied health researcher for about 15 years now, particularly interested in young people's school lives and young people with long-term physical health conditions. Previously worked in teenage and young adult oncology, which is one of my particular interests, but today obviously be focusing on asthma, and I'm part of the Centre for Applied Education Research as one of the co-leads for the child health in school theme. Catherine, do you want to introduce yourself?
Hello, thank you for having me on today. So my name is Catherine Hickman. So I'm a GP working in Bradford. I have a number of other roles as well. So I'm respiratory lead for West Yorkshire for both children with a colleague from Leeds and also for adults as well. And I'm the current chair of the Primary Care Respiratory Society and also primary care lead for the National Asthma and COPD Audit Programme. So I'm delighted to be here talking all things asthma.
Thanks, Catherine. Lucy?
Hi, my name is Lucy Fletcher and I'm the children's asthma nurse at the BRI in St Luke's, and I also work as part of the hospital at home team based at the BRI as well.
Excellent. Right, well, thanks for being here to present. Catherine, should we pass over to you for your presentation? You want to get us started?
Yeah, okay. I want to start with a story. So in 2013, I was very much at the start of my respiratory journey, and I mean really at the start of my respiratory journey. I was, well, firstly, I failed respiratory university. I only realised that about 6 years ago. And I was very much forced into this role of being respiratory lead, almost kicking and screaming. But once I did a bit of research into it and did a diploma, I got very interested in it. And the first thing that I did was become involved in the National Review of Asthma Deaths, which was the first audit of its kind, looking back at all asthma deaths over a period of a year to see what had caused those asthma deaths. And on the first day, we did a training session, and we had to review a set of notes. And I remember looking through this set of notes thinking, there's nothing here that surprises me. The care wasn't amazing, but it was nothing that I probably wouldn't have done in my own practice. The last thing that happened with that patient at the practice, she saw the practice nurse. The nurse said, "You need some steroids." And the patient walked out without those steroids and was found dead 3 weeks later with a blue inhaler gripped in her hand. And it made me go, and I still, when I'm saying it now, it gives me goosebumps. Not only what that patient must have gone through and the fear of her airways closing, but also from a perspective as a GP. Now I can now look back retrospectively and see all the faults in the care of that patient, but actually we are failing patients with asthma, and we now know that the asthma care since the National Review of Asthma Deaths in 2014 has actually got worse. It's not got better. But I was lucky in the sense that day was my epiphany moment. It was my light bulb moment. It was the day that I changed my practice. It was the day that I said to myself that certainly in my care, no person would ever suffer like that. And I see it as my job to spread the word about good asthma care up and down the country, both at national level and a local level, and also to speaking to yourselves, because ultimately we're speaking today because very often children spend more time at school than they do at home, and they certainly spend more time at school than they do in my GP surgery. And actually, as a parent, not of somebody who's got kids with asthma, but as a parent, I want to know that when I drop my kids off at school, they are in a safe pair of hands. And that if I had a child with asthma, I would want to know that every single teacher or person involved in their care at school knew some really basic stuff about what to do if my child was having worsening asthma symptoms and or having an asthma attack. And I think, and I know Lucy will speak more about asthma-friendly schools, but what I want to get across to you today in this webinar is that actually you don't need that much information to do this well, and it really is about getting the absolute basic care right. And it's what I talk about certainly at primary care level, that actually good basic asthma care is not that hard, and if we follow some really simple, clear rules, then actually we can really make a difference to the children who we care about. I'm just going to share a couple of slides. Share sound. Now, as I said in my presentation, well, that was my my light bulb moment, and each of these slides has a light bulb on it to signify that hopefully somebody on this call will have a light bulb moment and think, actually, now is the time for me to sign up to be an asthma-friendly school, because I am not confident what to do if a child in my care has an asthma.
Bubbly, cheerful, stretchy, and
mischievous.
She used to enter a room doing a cartwheel.
she was really good at gymnastics, and she used to win lots of competitions and things.
Always on the go, never sat still, so that was Olivia. That morning it was Red Nose Day and she'd had a lot of involvement at school. I picked Olivia up that afternoon.
She was lagging behind me, wasn't she?
Yeah, I was talking to Max and she was kind of slightly behind us. She just said that she'd had a tough day and been coughing. She came home, made her something to eat.
That's when we said, I think you should go to bed, you're really tired.
When I went into her room, she was on all fours on the bed. Her breathing was laboured. And I just said to her, you know, just stay where you are. I'm going to go and put your medication in my bag. We need to go to the hospital. I remember looking up to the top of the stairs and she was standing at the top of the stairs.
And then that's when I noticed her lips were blue. And then she just passed out in my arms, and then that's when we put her on the floor to try and
perform CPR.
But nothing was working.
I paced up and down the drive waiting for him to come, and then Lee and I went in the ambulance with her, but I kind of knew, really, that something, because her feet were yellow.
Really tough watching that, and I have watched it a number of times, and it still is very difficult to watch. And I feel like I'm talking a lot about asthma deaths, and fortunately, asthma deaths are extremely rare. But what is not extremely rare are all the near misses that myself and the colleagues on this webinar today see. And sometimes, unfortunately, it takes a death for a change to happen. And this little boy, Sam Linton, who died a few years ago, 11-year-old boy, and I think, as you can see, the title says that 5 staff at the school were suspended because he was left in a corridor with asthma symptoms, and nobody at the school had a grasp of how to handle and or treat or escalate the fact that he was having an asthma attack. And it was Sam Linton's death that led to schools being able to have an emergency supply of salbutamol inhalers in the school. As I said, the sad thing is that people do still die of asthma, but we know that up to 75% of those deaths are preventable. And as I say, children are spending a huge amount of time in schools, and it's absolutely imperative that teachers and staff at the school know how to deal with an asthma attack. And I alluded to before that I feel that as a healthcare system, we are very often failing our patients with asthma. And unfortunately, you are potentially sitting on some time bombs in school. So patients that don't fully understand what asthma is, they may not be taking their regular steroid inhalers. So they may have uncontrolled symptoms and are more at risk of having asthma attacks, which makes it even more important for you guys to know what to do and how to escalate it with the parents and or to the GP. Now, I know Lucy's going to talk a little bit more about asthma-friendly schools, but this is something that we developed as part of a West Yorkshire paediatric network. And this was on the back of conversations that I had with staff and an event in Bradford. Now, the guidelines will say that every child who has asthma needs a personalised asthma action plan. They not only need it at home, but they need a copy in school. Now, what teachers said to me at this event, they said, look, we have a huge number of pupils and a huge number of pupils that have really complex issues that are very individual to those children. But actually, with an asthma plan, we don't need to know what the child is taking at home. We don't need to know what tablets they're taking, what they should be taking when they're brushing their teeth or having their breakfast. We need to know what to do in that time if they are in school and they are having symptoms. And actually, we have drilled it down to this one side sheet of A4. And I think we believe that actually everything on here, if you were able to have that available in every classroom and or have a really good grasp of what was on that, then actually it would do our children a really good service, because it has links on there to how to use a spacer. It has links to show you what an asthma attack looks like, and it tells you step by step exactly what to do. And it really is, it was the colleague that I work with who also chairs the West Yorkshire Network. She said, essentially, an asthma plan is the same for those children who have severe asthma, for those that have very well controlled asthma. It's the same thing. It is very simple, but it's important that you have some training on it, and you know what to do, and you know where to get help if you have any questions. Now, Anil, who's on the call at the moment, we have spent about 2 years, I think, trying to get into a school in Bradford to do some work with primary school children and the teachers and the governors and parents to really try and co-create something with children to really help them to understand and manage their asthma and help them to remember to take their inhalers. We finally struck gold with Newbury Primary School. And the reason we struck gold was because when I said to the deputy head that actually some of your children who are not attending schools might have asthma, and this was Andy's light bulb moment, because he went away and looked at those children who weren't attending school, and a significant number of those children also were on his asthma register. And it was like the penny dropping, like, I need to do something about this, because actually the government is on my back about getting children to attend school. And actually, if we can support these children and their parents to understand asthma and to really make sure that they know what is going on in their airways, how to take their inhalers, and to make sure that we are an asthma-friendly school and can support them in that school environment, then really that will hopefully not only improve their asthma care, but also ensure that they're at school, not at home poorly with their asthma. And it's been such a real privilege working with the school, and this is just one of the resources that we've come up with that the children have helped design, and we're going to go back in the school and share some of those resources, and hopefully share widely across Bradford and West Yorkshire. So it really is a call to action, and hopefully some of this has inspired you to take action. I was on a call the other day, and we were sort of brainstorming, and one of the things that came up, that every school in West Yorkshire is an asthma-friendly school. I am a GP that works in Bradford. My mum's from Bradford. My daughter was born in Bradford. I would love to see it that Bradford was the first place in West Yorkshire that had every school signed up to be an asthma-friendly school, because none of you on the call want to be that teacher that is dealing with a child having an asthma attack and you don't know what to do, because it's really scary. I'm a GP. I have a reputation of being a very horizontal, chilled out GP that doesn't get stressed by very much. But I know that if a child is in my room having an asthma attack, it's really, really scary. And I have all the equipment here. So it's much better that you learn what to do. You identify the problem quickly, you get help, and you know exactly what to do. Thank you for listening.
Fantastic. Thanks, Catherine. That was really, really interesting. Just to remind people, and for any latecomers, if you've got questions that occur to you, there's a Q&A button at the bottom, which you should be able to access and post questions as we go along, and we'll be able to come back to them after the presentations and answer anything that comes up. That was really interesting, Catherine. Thank you. It's interesting for me because I'm now about to present about what young people in high schools have told us. So it's kind of interesting to hear some of those stories around that, some really impactful stuff there. I can see that we don't have anything in the Q&A at the moment, so I think I'll just move on to my presentation, and then we can do some group discussion at the end. Although I can see that we've got two of our panel members joining the group. They both joined under my name on the Zoom there. So Anil and Matt, would you like to introduce yourselves before I move on to my presentation? Anil, would you like to go first?
Thank you. My name is Anil Shenoy. I'm a consultant pediatrician here in Bradford Royal Infirmary. I deal with children with asthma, along with my team, along with my colleague, Lucy Fletcher, and I also have another colleague called Dawn Woodward as well. So we see children, especially when they present in the wards, but also thereafter, they come back to our clinics, and we just go through their management as well. And we do that quite routinely in the wards.
Thanks, Anil. And Matt?
So hi, I'm Matt Mathai. I'm a general paediatrician like Anil, with a real vision for health and education, become more closely aligned for lots of really good reasons. I'm also part of the BIB exec team, and work with Simon to see how we can how health and education actually can get closer, more closely aligned. So glad to be here.
Thanks, Matt. Nice to have you both here. And when we finish the presentations, Anil and Matt will be here for any questions that anyone has, or any kind of discussion that we might have to join in with that. I can see that we've got a question come through on the Q&A, so perhaps we'll go to that before my presentation. This person says, hi, the school asthma plan with the links, is the one available that is non-digital, just a paper version of the poster with the information on to put in the classroom? Also, do you have any specific advice for boarding schools? Catherine, would you like to take that question?
So, yes, so non-digital, just a paper version. So there are a couple of things. Yes, at the moment it is non-digital, but we are launching a series of apps tomorrow across the whole of West Yorkshire that have been used in Wales for a very long period of time. And there is a digital personal asthma action plan on there. So that is something that the children can have that would be digital and potentially shared with the school. But for me, I think this would work very well as a poster in the classroom. I think what you need is it there, visible, because obviously an app on a phone is no use if a kid doesn't have their phone in school. You want instant access somewhere that it's visible and you can see immediately. That's what I would say. Specific advice for boarding schools. I mean, it really is the same, apart from the fact you've got the added issue of making sure that they take their steroid inhalers. And actually, if you don't get that bit right, then kids really do run the risk of having uncontrolled asthma and having asthma attacks. So that is the key, that if you're talking to children about remembering to, I don't know, brush their teeth, for example, then how about talking to them about remembering to take their inhaler and linking their taking the inhaler with their brushing the teeth. But you become the parent at the boarding school, don't you? And I can imagine it's not easy, but it is the role of everybody to make sure that child is taking their inhalers.
I think the one-page guide that you put up lends itself very well to a poster, doesn't it? And you said you condensed it all into that one side. I can imagine in schools having that visible and available, especially if something was happening, a child was having symptoms, then that would be a really good thing to go to, wouldn't it?
Yeah.
Okay, does anyone else want to comment on that before we move on to the next presentation?
I'll just make one comment. I forgot to mention it in my presentation. So when I did go into this school, every single child in the school they were all from 6 above, they all had, I think I've got one here. They all had this tiny little mask that didn't fit on their faces. So yeah, that was a fault of the GP who'd prescribed them the wrong inhaler that had just been sitting this, and obviously their mouth, their faces get bigger, they need bigger spaces. So I had to write to the GP to say, just warning you, you're going to get this influx of angry parents saying they want a different inhaler because Dr. Hickman's been in. But yeah, it's got to be a whole team approach, doesn't it?
Yeah. Okay, right. Thanks very much. Right, we'll move on to the next presentation, which is me. So let me just share my screen. Okay, so do I need to swap my view around again, Catherine, like before?
So we can see the slides down the side.
Oh, okay, yeah. Let me just change that.
Do full screen. It should be.
Hold on 1 second.
That's gone back to where you can see the 2 screens.
Yeah, okay, yeah. I'm just trying to change my view. Hold on. Oh, I don't have the same settings as I had in the last one. That's interesting. Okay, is that any different or is that still the same?
Yeah, it's still the same.
Okay, there was a display setting button. Let me just see if I can find it. Hold on 1 second. Ah, there we go. It's hidden by a toolbar. Okay, we got it now. Okay, so hopefully you can see that now. So I'm going to talk about the in-school project. So this is a research project that we've been doing over the last couple of years, which has been looking at the school lives of young people living with long-term health conditions. One of those health conditions is asthma. So in today's session, I'm going to give an overview of the in-school project as a whole. talk about briefly about some of the overall findings, because we've been looking at the similarities across young people with different types of long-term physical health conditions. Then I'm going to pick out some of the specific findings related to our participants from the asthma clinic, and then talk a little bit about next steps and what we're going to do with the project. So the in-school project overall is a National Institute of Health Research funded 5-year project, answering 2 main research questions. The first one is, what impact do long-term health conditions have on the school lives of young people? And we plan to answer that with a systematic review of all the research that's been done in this area. So we've looked at specifically qualitative research that's talked to young people about what their lives are like at school. Then we've just completed a large-scale qualitative project of our own, where we've been inviting young people to take part in interviews with focus groups and tell us about their experience of their life at school. The second research question is about how can we accurately measure this impact so that we can plan and evaluate meaningful interventions in school and in clinics. A lot of research in this area uses attendance and attainment as primary outcome measures, but speaking to young people, obviously their life is very well-rounded, full of lots of different facets, and we wanted to see if we can use some of their information to develop a more meaningful assessment. So we plan to use the outcomes of these first 2 work streams to create a needs assessment that can be specifically used in clinics and in schools to screen for young people who might have unmet needs, but also used in research as a more holistic outcome measure. We're then going to use this tool to conduct a national survey to provide a big pool of data on young people with long-term health conditions and the needs they have in school. And this will give us data for where we can develop meaningful interventions in the future. So our qualitative evidence synthesis, this was our review of all the literature, all the research that's been done to date. We had nearly 13,000 results in our search, but only 36 of these produced articles that had really spoken to young people in any way about what their life was like at school. And out of these, only 4 had material that was specifically related to young people with asthma. And we went all the way back to look at research from as early as 1940. And these were the 4 articles that we found that specifically asked young people with asthma about what their lives were like at school. And we've had this article published in the Archives of Disease and Childhood, and I'm happy to share that with anybody that's interested. So before I go on to talk about the qualitative project, I wanted to talk a bit more about how we've involved young people in the research. So this was always designed to be a very much young person driven project. So we've been working with Leeds Youth Forum particularly, but other young people's groups around Leeds. We met with them to set the agenda for the project. So when we just had a very broad idea, they helped us to be more specific. We've got young people who are on our steering group, who've helped us plan and design our methodology, who've helped us design and review our study documents. They also designed the logo that you can see there and designed some preparation activities, which have been really key to our data collection. Some of them also took part in pilot interviews so they could feel what it was like to be a participant, and then they could give us a more informed view of what they thought would work or wouldn't work for young people. And we've just completed some participatory analysis. So a group of 5 young people have helped us to look at what other people, young people have said in the study, and help us to draw out what they think the most important things are. So very young person driven all the way through. So the qualitative study itself, so we were interested in 11 to 18-year-olds, so those in secondary school age, who were enrolled in a mainstream high school. And we were looking at young people from one of these 11 long-term physical health categories. So we wanted to look, in our review of the literature, we found that there were lots of long-term conditions where there was no research at all really done on what life was like at school. So we wanted to bring in some different groups, all with long-term health conditions. So during the course of a year, we had 133 people referred to the study, and we had nearly 90 of those take part in an interview or focus group. So we have a large group of young people's stories really from across all of these different conditions. And you can see there we had 9 people from the asthma clinic. So the qualitative study basically ran like this. So we had young people recruited from Leeds Children's Hospital outpatient clinics. So they were referred directly from clinical staff there. They were invited to take part in an interview or a focus group because our young person advisory group pointed out that some young people would be more comfortable one-to-one and some in a group setting. We had an alternative written task for those who wanted to take part but didn't feel comfortable actually talking to a researcher. We had the preparation activities that I mentioned, which were designed to give the young person something to engage with before they came to the interview, so that they could have a chance to prepare what they might want to say and wouldn't get caught out by a flurry of questions from a researcher. And so all of this led to very much young person-led accounts of experience. So when I go on to tell you about the results, these are the things that we've made a big effort to try and make as young person-led as possible and try and avoid our own assumptions. Just quickly, here are the preparation activities. So young people were given a choice of 4, so they could either do this very simple Venn diagram here, or they could complete this target activity and look at some of the variables associated with school life and rank them in importance. They could create a mood board themselves before they came and present this to us, or they could write a letter to a celebrity or somebody that they respected. And the idea was that they bring this preparation activity to us and talk us through that activity, and that would make the entire interview. We didn't have our own questions or topics, so everything here is very much about what young people told us. So looking at the overall findings, we tried to draw out what the fundamental needs were that young people had at school. And we picked out 6 needs really and in consultation with our advisory group. So as a young person with a long-term health condition at school, they said that they needed to be able to manage their conditions safely at school. They needed a flexible education pathway that would adapt to the time they missed from school or the times they were struggling to keep up with schoolwork or concentrate. They needed to be seen, acknowledged, and listened to in the right ways, and this was a very key part of the findings. Need to be included in and supported by the school community. Needed to be able to build towards their future, so this was thinking about things like exams and jobs, but also key transition points within school, building safely towards those transitions, perhaps changing school years, starting GCSE periods, changing schools, that kind of thing. And also the opportunities for personal development. This was partly to help them cope with having a long-term health condition in school, but also as a way of recognizing the skills that they were developing themselves. So moving on to the asthma specific findings. So one of the things that was talked about a lot with the young people with asthma was their self-management skills. So they told us that over time, they became more confident and competent at self-managing their asthma and taking their inhalers. This was particularly true as they sort of transitioned through the years at high school. They became increasingly aware of what worked for them and what didn't work for them, kind of things that they needed. So you can see this person here said that in secondary school, they kind of know what they're doing with their asthma. And we heard that story quite a bit from especially the older participants. However, some participants told us that they have to work really hard to manage their condition. So even if they know what they need to do, they're having to quite often work very hard to keep on top of that. And they don't always feel like this is recognized or appreciated by friends and by school staff around them, especially if they are doing it successfully, so they're not demonstrating any symptoms or problems. They're quite often having to work quite hard to make that happen. One of the other asthma-specific findings was panic. So Catherine alluded to a little bit of this in her talk, that asthma attacks can cause panic for young people, and so a calm environment is very important to them. Many young people told us that their perception that staff were panicking and didn't know how to manage the situation would exacerbate their symptoms, and that would become a snowball effect, really. So young people said they were usually happy to take the lead if they could on what they needed to manage their asthma symptoms, but they needed to be calmly supported by staff in a safe environment. So you can see the quote here from a young person who had severe asthma was saying that he could really feel that build-up of panic and that sort of piling up of increasing anxiety, and said that he felt like he knew what to do, but was having to also manage the panic of the environment around him. So that made things more difficult for him. However, despite that, we'd also heard young people talk about the awkwardness of using inhalers in school, and some talked about their discomfort at being seen using an inhaler or having to manage a difficult asthma-related situation. So this person said they're not exactly just going to whip out a inhaler in the middle of an incident because it's kind of awkward. And the second person says that they really were worried about being seen as that kid who has asthma. And we actually heard this from quite a lot of our other young people with different conditions as well. Using these kind of devices or medications would highlight them as somebody that's different within school, and that was a difficult situation for some of them. There was lots of discussion about PE to do with asthma. So management during PE and physical activity was particularly important for this group. The importance of medication being easily accessible to them, staff understanding the limitations that they might have physically to take part in some activities and being able to take breaks, but also being able to have the medication they need available, easily accessible to them. So this person said they tried to limit what they did in PE because they weren't able to have their inhaler with them during the activity. So they tried to dial down what they were doing in the PE lessons. But this young person pointed out, which we heard a couple of times, that it was often the lesson immediately after PE or games that could be more difficult and uncomfortable. So this person gives an example of having gone to a maths lesson after PE and then started to get increasing asthma symptoms, but was told in this situation that they weren't able to go to the school nurse for support, and they just had to sit there and use their inhaler in the lesson. But this was one of the young people who'd also highlighted their awkwardness with using those devices. Another thing was perception and assumptions of people around them. So we heard some people say that because asthma is quite a common condition compared to some of the other conditions we were looking at, they felt like it was not something that they had to explain necessarily what it was and had to be believed that they had it in the way that we heard from some other young people from different conditions. But they did find that some people's assumption that it's quite a common condition actually made it more difficult for them to cope with the more sort of severe asthma or brittle asthma type conditions, because people had assumptions that it was a common and easily managed situation with inhalers and things like that. So this person gives a long example of something that we heard quite a lot, which is actually he knew how he wanted to be managed in school, but then didn't feel like that his wishes were listened to within school. So then that made him frustrated. And then he said the teachers perceived that he was back chatting, as he says in his own words here, and that was kind of a cycle that continued and could be quite frustrating for him. And he was also sympathetic with the teachers and said it could be a very frustrating process for them as well. And actually, we heard about this from a lot of participants, this cycle of trying to say what they needed in terms of managing their condition in school, but having difficulties with that being listened to or feeling like it had been listened to, and then feeling frustrated, perhaps getting into more trouble, and then not feeling as confident to ask for what they needed for them. So these are all reflections that we got directly from young people. These are not my opinions about what the situation is, but this is what young people have told us themselves. So a few final thoughts and reflections. Young people with asthma at secondary school are often increasingly competent at self-managing as they get older, but they need to be supported to lead their asthma management where it's appropriate, and consulted and included in plans for how best to manage their condition overall in school. So clear plans need to be in place for different levels of asthma symptoms. This is interesting because this is what young people have told us, and listening to Catherine's talk, I wonder if there are different levels that need to be managed, or whether there is a good sort of stock way of managing asthma symptoms within school. But I feel like young people feel like calm and private spaces should be available for them to use their medication if this is an important factor for them. But this is something we heard from a lot of our young people with asthma, but also a lot of other young people in the study, that regular check-ins would be welcome, even if there's no visible signs that there's anything wrong. So to check in, see how they're coping with managing their condition, see if they have anything that they need more support with. And even if they don't, that recognition and that check-in, very valuable to young people. So before I finish, just a few next steps about the project. So we have just launched a parents version of the project. So we want to understand how parents are involved in managing different conditions and their experience of navigating school and hospital services. We're writing up these the methods and the results of this paper, but also specifically writing a paper about what young people have told us about attendance at school. We're developing the new needs assessment, but we're also planning to start engaging with schools. We've intentionally started with the young people on the sort of health side of things, and we want to start engaging with schools to assess how this is currently how conditions are currently managed in school, and how the sort of things that we're learning from young people and that we'll learn from our next phase of our project, how that could be used to help support the management of health conditions in school. Okay, thanks very much. Then my slideshow there. Okay, so we should be back to full screen view. Okay, so I'm seeing if we've got any questions. We've got a question here. How often do you recommend check-ins or reviews for students at boarding schools? I can see, Catherine, you said that you want to answer that question.
Oh yeah, well, I didn't mean to click that, but I will answer.
Okay, go for it.
I meant to say I'll just type it. But so similar to anybody with asthma, so your asthma annual review, but also if you have an asthma attack, i.e. you end up in hospital or you're seen by the GP, then you would need more follow-up at that point to make sure that you're back on the straight and narrow. I think sometimes we rely too much on the asthma annual review. I mean, at the end of the day, it is 20 minutes of an entire year. And actually, we need to be able to say to our patients that you should be able to access healthcare whenever you feel that you need it. So if you have worsening symptoms and you're not in control of it, then you need to speak to somebody. And I try and say to people that, you know, if you're using your blue inhaler more than 2 or 3 times a week, especially if that's more than you normally do, then you do need to see somebody to get your inhaler technique checked to make sure your understanding is right. And you know, what has potentially changed? Have you started vaping or smoking? Is that why your asthma's got worse?
Okay, great. Thanks, Catherine. I think there's also a reply to your previous answer saying about they were wondering if the information on the links could also be included on the poster, as staff and students may not be able to access the links. This was about having like hard copies of the sort of materials and information for schools.
I was just typing that actually. So,
okay.
So all these resources are available as part of the asthma friendly school package. So they're available to be printed off and put in classrooms. So yeah.
Perfect. Okay, thanks. Catherine, can I ask you a question?
Yes.
It occurred to me after listening to your talk and then presenting my talk. So, so I said in my final thoughts, and these were things that came from the young people, about how sort of clear plans need to be in place for different levels of asthma symptoms within school. So we spoke to some young people who had quite mild asthma and just needed access to their inhalers when they needed it, and to be careful with their physical exertion in school. And then we had some people that had much more severe asthma and were having much more sort of serious problems in school. I wasn't sure from your talk whether you felt like there do need to be these kind of aggregated plans for different levels of asthma problems within school.
It's interesting. I suppose I suppose it's about the basic principles, isn't it? And the basic principles of asthma are quite similar in the sense that you've got to take your steroid inhaler, you've got to take it every day, you've got to take it right. And if you are having symptoms, then that is a sign that things aren't controlled. And it's not really the school's responsibility to manage treatment or anything, but as it said on that thing, what it is to do is to escalate it to the parent to say, your child has used their blue inhaler 3 times today. I recommend that you go and get an appointment with your GP or the nurse and or the secondary care doctor if you're under them, because I think it's about having a sense of what is normal for that child, and if they're moving away from that and struggling, but it's having the knowledge to recognize when a child is struggling, and it's that, you know, are they coughing, are they wheezing, are they asking for their blue inhaler? And then, you know, I mean, my kids' school, they have to have it written down every time they go to the toilet in their planner, and the reason they have that is because kids were going out for a vape in every single lesson. So it's now documented if they go to the toilet. Now, if you can document that they're going to the toilet, you can definitely document if they're asking for their blue inhaler. And then you've got a record at the end of the day, say, oh, wait a sec, they've asked for the blue inhaler, and, you know.
That makes a lot of sense. And actually that really kind of feeds into some of the other points that we had from some of our participants about how they want to be more included in the way that plans are developed and managed within school. And the idea of doing kind of regular check-ins with young people might be a way of asking them what their recent symptoms have been and anything they're struggling with. It might be a way of flagging those things, even if they weren't recorded, which would obviously be ideal. To be able to get some of that as a dialogue with the young people in the family might be really useful.
Yeah, and it's just, you know, schools will come up with a policy. Our policy is that the inhalers are kept here. This is how you access them. But actually, we need to involve the kids. If they, you know, they should have access to them themselves if they're able to use them, certainly if they're older, but equally some sort of safety netting to make sure that somebody is aware that they are taking it. So they're not just busy taking their blue inhaler 6, 7, 8 times by themselves. So it's hard to get the balance right.
Yeah.
But the key is involving kids. And I have absolutely, that work in school was just, again, that was my sort of light bulb moment. They were amazing. And also involving the parents as well to hear what's going on at home as well. Yeah. For them to say, look, we forget. I was like, you do, because you're human.
I think involving them, it has so many good kind of implications for how they're managed in school, but it also has implications of how they experience being in school and how kind of well they feel kind of part of that and cared for by the school. I think to have that involvement in how their condition is managed has that sort of double effect, isn't it? Which is really useful. Lucy, let's just carry on talking, but I won't. So let's, Lucy, do you want to do? We'll pass over to you for your presentation, if that's okay.
Yeah, that's fine. So I'm Lucy, one of the children's asthma nurses, and my colleague Dawn is on the call now as well. We job share, so she's the other children's asthma nurse at Bradford. So we're just going to talk a little bit about asthma-friendly schools. So there's the specialist nurse that does that is what's called Carly, and she was leading going into schools and leading the asthma-friendly school initiative, but her role's come to an end now. But I will give you her details because she is still available for any guidance and advice if anybody needed any. So asthma is the most, let me just share my slides actually. Are they there?
Yep, looks good.
Ooh. Are they moving?
Not so far. I can just see the asthma in schools slide.
Let me do it again. They're moving now.
Yeah, that's good.
Sorry. Okay, so asthma is the most common long-term medical condition in children in the UK, with around 1 in 11 children and young people living with asthma. The UK, we know that UK has the highest prevalence of emergency admission and death rates for childhood asthma in Europe. And as we all know, outcomes are worse for children and young people living in deprived areas. So the West Yorkshire Asthma Friendly Schools initiative was set up to improve the care of pupils with asthma by raising awareness through information, training and support for school staff, as well as pupils, parents and carers. So the benefits of becoming an asthma-friendly school were identified as improved asthma awareness and management in schools, improved support to pupils with asthma, encouraging an inclusive environment, additional support with the health, safety and well-being of pupils, ensures the school are implementing current and best practice asthma management strategies, and it enables the school to promote its self-evaluated status and ensures that the community is aware of the school's commitment to asthma-friendly strategies. So once the schools become asthma-friendly, you get a certificate. And my little girl's school, it's actually in Leeds, but in the entrance they've got it displayed on the wall, the certificate that they are an asthma-friendly school, so everybody knows. So to achieve asthma-friendly school status, your school will need to meet the following key objectives. All staff in school to be trained in asthma awareness. So this is something that Carly used to go in and do face-to-face, but it is available online, and the link is on the next slide where you can access that. Each school to have an asthma policy, each school to have an asthma register, parents, carers to be encouraged to share their child's management and asthma plan, a consistent approach to where and how inhalers are stored in school, a notification system of when inhalers are due to expire, each school to have a spare emergency inhaler and spacer, and a process in place of when to escalate cases to a health professional. So these are just details, Carly's email address, and she's happy to be contacted if anyone did want any advice or guidance. And then the link underneath there, it has all the information on it, everything that you need to do to achieve asthma friendly school status. So so far in Bradford, Catherine, correct me if I'm wrong, but I think 12 schools have become asthma friendly.
I think that's right. I think it's 12.
And she had, so Carly's been into all the schools and met with the teachers, and some of the key things that she found that weren't already happening were children having the incorrect or no spacer in school. The majority of children did not have an asthma plan in school, and many schools did not have an emergency inhaler kit, so a spare inhaler and spacer kept in school. So spacers, so these are the different spacers. So Catherine showed you the yellow one earlier, so that is a spacer with a mask, which as soon as children are able, they should be using a spacer with a mouthpiece, because it's the best way for them to get the medication. All children should be using a spacer, so they should all have spacers in school. Simon just highlighted that in high school the children were almost embarrassed to get their inhalers out, or they didn't want to whip their inhalers out.
Yeah.
So there is, I've not got it on here, but there is, you may have seen other devices. So there's an easy breathe device called portable devices that you don't need to use a spacer with. So we would always encourage, once they go to high school, we would always encourage them to change to one of them, because they often won't get the big volumatic spacer down here at the bottom. They're not going to get that out in the middle of class, so then they would just use the inhaler without a spacer, which is not going to be as effective. So that is an option, especially in high school, that they can have a portable device. It's just important that they know that if they are having an asthma attack or they are really struggling, then they would need to use a spacer. So I'll just come back to these. I'll just show you this, which just highlights why you need to use a spacer. So the image on the left is without a spacer, and the one on the right is using a spacer. The image on the left is without a spacer, but it is actually using an inhaler correctly. So even using it correctly without a spacer, you can see the black dots is obviously the medicine. A lot of it is left here in the throat and not getting to where it needs to be, whereas when you use a spacer, the majority of the medicine is reaching the lungs, which is where it needs to be. So the different spacers there, just go back. So the yellow one is using a mask, and we normally, I think everybody in school should, if they are able, should be using a mouthpiece. So Carly found that a lot of the children had these yellow spacers with a mask. The blue one is again with a mouthpiece. So either or, the blue one and then the volumatic can be used. They're used very similar, and I've just got some here, so I can just show you how we use this. Can you see me as well? Yeah, so this is a volumatic, which is the one that we favour just because it's easier to use, and if we're swapping someone from a mouthpiece to the volumatic, then it's easier to make sure they're using it right. So we'd always shake the inhaler, pop it in the side here. It has a valve on it, so when you take when the patient takes a breath, the child takes a breath, it clicks. So we would always say for every puff of inhaler they need to do at least 5 breaths, so to count the clicks. So using this spacer, they need to breathe through the mouth, because if they breathe through the nose, it's not going to work. So for every puff, 5 breaths, so count 5 clicks, then shake the inhaler, and if they need another puff, it's another puff and another 5 breaths. The blue inhaler, the blue spacer is similar. It just doesn't, the ones we use in Bradford just don't have a valve on, so you can't, there's nothing to demonstrate that they're doing a good breath. So that's just the difference, but either or they can use. And then the one with the mask, which unless they, for whatever reason, they can't use the mouthpiece, it has a yellow valve here, which moves backwards and forwards when they take a breath. But they're all the same, so 1 puff, 5 breaths, and to shake in between each one. And then, so asthma plans was the second thing that she found. So this is an example of an asthma plan that we use, so that Dawn and I use in clinic, and we use them on the wards in the hospital. But it's from Catherine's talk, it does have up here the preventer inhalers and any other medication down here, which she rightly said that the teachers don't want to know that. So the information here is how many puffs of the inhaler to take and when and how to step it up. So the one that Catherine showed is probably better for schools, but this is the one that if the child has been under the hospital or been into hospital, then they may come into school with this. And then the information on the bottom here is at the bottom here is similar to what was on Catherine's. But the National Review of Asthma Deaths, which Catherine was talking about back in 2014, that one of the key recommendations from that was that every child or every patient with asthma should have an asthma plan. So it's really important that everybody has one in and out of school. And then the third common thing that she found was that schools didn't have an emergency asthma kit. So every child should have their own spacer and inhaler in school, kept in school. But then each school should also have an emergency inhaler and spacer for whatever reason, if they need to use it. So the way, I think Kylie did find that some were having trouble getting hold of one, but all schools should be able to get an emergency inhaler and spacer from any local pharmacy. So what they need is a signed letter from the head teacher, which ideally should be on headed paper, which should include the name of the school that's making the request, the purpose for which the product is required, so for an emergency use at school, the product details including the spacer, and then just a signature of the principal or the head teacher on the letter and the total quantity required. So for primary school they should just need one, but then they do have expiry dates on, so they need to be that need to be kept an eye on and renewed every year. And then I think that was it. I think that they were the three main things that she found. Another thing that's not on here that she did find were that children were being kept in a lot, kept in at playtime or kept in at lunchtime as a request from the parents, which they were just doing that. But we would always, unless the children were under the hospital, there was a specific reason why they needed to keep in, or the weather was particularly damp and damp weather affects their asthma or something like that. Children should not be just routinely kept in from playing outside just because they've got asthma. So these children, it was just the parents saying that they can't play outside in any weather, and they had quite a big group of them that were always staying in during playtime, which we wouldn't, and I think you'd agree, we wouldn't advocate. And that's it.
Excellent, thanks Lucy, that's brilliant. Yeah, if you stop sharing and then we'll go to some questions. So I think we've got a specific question, a couple of specific questions come in for you. So this person says, our GP hasn't issued spaces to all of our students, so should we contact our GP and ask them for it to be issued? Bracket, as we're a boarding school, we take care of all of their healthcare needs.
Yeah, every child should have their own spacer. So if they weren't at boarding school, then we would say that the parents need to go to the GP and request one. So yeah, they should all have one, and if that's something that you can do, that's good to ensure they've all got one. Absolutely.
Okay, excellent. And then another question, how many emergency kits do we need for a secondary school? Brackets, does it depend on size of school, and if so, how many?
I'm not sure. So definitely one for a small primary school. I'm not sure what the policy is for the high schools.
Yeah, it's hard, isn't it? I mean, you'd be a bit unlucky to have two people going off at the same time, but I mean, I'd probably say a couple.
Yeah, for the bigger
schools.
schools.
It's about where they're stored as well. So if you've got a big school, you don't want to have to travel a long way to. So I think the key is it's more about everybody knowing where it's stored. Yeah, it's really tricky. Well, I couldn't say that you should have one in every classroom, but
they won't. I don't think they would give me one with that.
You might want one on every floor with a specific point.
Yeah, if it's a big school, I think it would be reasonable.
Yeah,
that makes sense.
And a fast runner.
So another question, we asked the parents for an asthma plan from their GP, but they say they are unable to provide one.
Well, the GPs, I mean, Catherine will agree that they should all, they have the GPs should have the same asthma plans that we use in clinic. They should have access to them. So, and every patient with asthma who goes to the GP should get an asthma plan.
Yeah, they won't get it from the GP because GPs don't do them. But absolutely from the practice nurse who are paid to do personal asthma action plans. It's part of our payment system. We have this thing called QOF. And as part of every asthma review, every patient with asthma should have a personal asthma action plan. So if nothing else, that is incentive for them to do it. They get cash.
So what was that person's role in the clinic? Did you say, Catherine, whose responsibility?
The asthma nurse. So
yeah,
it's part of the annual review. Yeah, but actually the best people to talk to are the nurses, not the GPs, because the GPs will probably say we haven't got time to do that. But nurses doing reviews get a significant, most nurses get 20 to 30 minutes. And I've always argued that actually an annual review should start with the personal asthma action plan. Let's get it open, let's get it out there and do the review with the personal asthma action plan, because it allows the patient to know what to do when they leave the room. And it also allows the clinician to tick the boxes. So everybody leaves happy. The trouble is it gets left and then it's like, oh, we haven't got time to do it. But actually, if you prioritise that and did it first, then everybody would have one.
Anil, did you want to come in with that one?
I think it's more a comment than anything else, especially if the child has presented to the hospital. You would expect that they are being provided with an asthma action plan. And especially if they come to our clinic, we would definitely be providing them with an asthma action plan. So we are working towards any child who comes in unwell to the hospital. Before they leave the hospital, they are provided with an action plan that they should be able to then provide it to school or their, wherever needed.
Yeah, because that would seem like such a good starting point for schools, wouldn't it, to talk to the young person and family about how to manage the asthma within school. That would seem like a really important document. We have another question, a clarification, I think. What age are you suggesting should be using the blue inhaler?
Spacer or inhaler?
The question said spacer.
The blue spacer. So as soon as you can use a mouthpiece, you should be using one. So I mean, when they start at school, so 4 or 5, they should be able to use one. Some 3-year-olds can, and some 4 and 5-year-olds can't, but as soon as they are able. So generally everybody at primary school should be using one. Would you agree, Don? Yeah.
Okay, great. Thanks, Lucy. There's no more questions coming live. We did have a question sent before the webinar started, which was, why do we no longer have the school nurse coming into schools regarding training on asthma and EpiPen held in school? That was the question that somebody submitted before the webinar. That's
just to do with capacity, so there's no funding for it anymore, and it is a massive loss. We agree, but there's not the staff or the funding to do it, and there's a gap. It's not really being filled. But
I think it's slightly better, but I agree, it's absolutely down to funding. But I know they have got a few more, and they are being trained up, and asthma is on the hit list for more training. But yeah, it would be amazing, wouldn't it? Because actually, this is where the work needs to be happening. I think we could have far more influence at school than you can have in primary care. Actually, I know everyone is very stretched, but actually to do that kind of mass teaching of kids in a school, go to them. I know there was a bus down south that started doing their asthma reviews. They would go to the school. Kids would just come out and have the asthma review at school. So you're capturing them where they already are, rather than relying on them coming to us and relying on somebody to bring them as well. Because it's not the kid's fault if they don't come to the appointment, it's the parent. So, yeah,
that makes a lot of sense. Okay, so we don't have any more open questions come in from people who have attended the webinar. Matt or Anil or Dawn, did you have any comments or questions about anything that we've presented or discussed, or any other things you wanted to raise?
I would wish to make a point, and I think more so to mention, we have found sometimes some children, for whatever one reason or the other, are much more iller than other children while dealing with their asthma. So in other words, they have presented a few times to the hospital, and we have realized over time that they have not been taking their inhalers as much as they should be doing that. So we're talking of the preventers here. So what we have found is linking up with school has been perhaps one of the most productive things that has ever happened. So in other words, once they start taking their medications quite regularly, which we know will make a definite effect, both to preventing them from coming to the hospital, and also more importantly, to ensure that they come to school quite regularly. We have realized that we have had good link up with schools, both primary and secondary. And I think my colleague Dawn has played an important role in this. So we have had the success of ensuring that inhalers have been provided in school under supervision. So in other words, this is something that should have happened at home, but this has then happened in school. And we have found some fantastic, I think positive stories from that as well. And in fact, over time, we have also realized that now there are medications that we can use even once a day. So we can give these medications quite effectively. So I think schools have definitely helped us in a big way. I think, and I think we are very grateful to that, because that does make a big difference, and it has a big impact to the child as well. And I think we have been able to demonstrate that quite effectively, to tell you the truth.
It's fantastic to hear. Great, thank you, Anil. Matt, got your hand up?
Yeah, no, I was just echoing Anil's words there. Really, I think this webinar really has shown the great potential there is in terms of health. We look after children quite often in discrete episodes of care, whereas obviously children are in schools, every day of the week, and I think we're thinking more in health now of not just health but also of well-being. And I think you touched on things around empowerment and what children actually wanted. And Catherine touched on, actually getting children to, advocate for themselves, and schools advocating for their children with GPs and practice nurses. And obviously Lucy's talked about actually how you can support schools to provide the right type of health. So I think chronic illness, asthma is one of the major chronic illnesses, but 15 to 25% of children going to school have some form of chronic illness, and we could be doing these with other long-term conditions that children are suffering from. So I think it just shows that these conversations are really important, and we're really keen to support, I think, in health, certainly these interactions, and hopefully over the coming months and years we will have many more of these discussions. But it's been really interesting to listen in on all the work that's been going on. So thank you.
Yeah, thanks, Matt. I completely agree. Having spent the last year speaking to young people from across lots of different chronic health conditions, the similarities absolutely dwarf the differences. Obviously the way that things present is different clinically, but the experiences that young people have in school and the general underlying principles of how you might go about managing those and developing interventions and resources are all very, very similar. There's so much commonality there that I think, and my view is that for schools to manage those conditions in a very similar way across lots of different kind of health conditions actually gives them a larger proportion of their school population that they can kind of address and provide for. So yeah, I think asthma is a really important subject, and I think we can learn from that for other conditions and vice versa. So these kind of conversations are really, really useful. And if anybody's watching this recording back, I know a lot of people engage with these webinars at more convenient times for them. Obviously, feel free to get in touch with any thoughts or comments or questions that you have for anybody here. So there's no more Q&A questions come in. Has anybody got any final points they'd like to make before we stop the recording?
Are we going to send around the links to, for example, how to become a asthma-friendly school? And there's also a...
Yeah, I think the plan would be to circulate the links to the recording, and then we can also circulate any other links and material with that email. Yes. I think, Mallory, I think that's probably what we'll do, isn't it? Yes, we can send the links. I can see that. Okay, so we can send other relevant materials that we've covered in this topic. Okay, well, if there's no further comments or questions, I think we can round up. Actually, I hadn't even checked the time. We're only 3 minutes from the end, so that's actually good timekeeping accidentally there. So thank you to everyone that's contributed and joined. We'll stop the recording now, and hope you found this useful.
Thanks, everyone.
Thank you.